I'm Ian Welsh, Chief Executive of the Alliance. The stress, strain and anxiety of living through a pandemic has touched all of us, but people living with long-term conditions have been especially impacted. And we've known for a long time that living with long-term conditions can and often does have a serious impact on people's emotional health and well-being. The fluctuating cycle of illness and well-being for people with long-term conditions can be a major challenge. And the psychological impact of being diagnosed with a condition, experiencing symptom flare-ups, and or living with progressive conditions cannot be underestimated. This has been further exacerbated during the pandemic, where disruptions in access to healthcare supports and self-management routines have been particularly felt by people living with long-term conditions. Some people have been shielding for long periods of time. Others have lost access to self-care mechanisms. And many people have felt significant fear for both themselves and loved ones. Now, as we learn to live with and recover from COVID-19, supporting the emotional and mental well-being of people living with long-term conditions must be prioritised, in our opinion. Now, recognising this need, I'm very pleased to announce a new programme, Living Well, Emotional Support Matters, which has been delivered in partnership between the Alliance and the Mental Health Foundation, and will see £500,000 invested in Scotland into mental and emotional supports for people living with long-term conditions.
My name is Lee Nifton, and I'm the Director of the Mental Health Foundation for Scotland and Northern Ireland. And as we all know, the pandemic has really impacted on the mental health of our citizens and communities, but those who experience pre-existing inequalities have been hit hardest. That's why the Foundation are investing over £1 million of our resources, and that's being matched by partners and investors. So we're investing £2 million across the UK to really provide targeted, evidence-based support to communities that have been affected, particularly, and that we have evidence through our own research that includes Black and ethnic minority communities, refugees, lone parents, and people with long-term conditions. And together, we'll launch initiatives across the UK in the coming months, which are really focused on supporting wider organisations to build mental health into the activities that they do on an everyday basis. So that's why we're really delighted to work with the Alliance. And we're calling this programme Living Well, Emotional Health Matters. And it's really focused in Scotland on supporting those who experience long-term conditions. And the Alliance are matching our funding, and that investment will then be shared amongst 8 partner organisations that work on the ground and with communities of people who experience long-term health conditions. The underlying purpose of this fund and this work is not just to provide immediate support to alleviate suffering, well, that's hugely important. It's to build the capacity of those organisations to take this forward in the longer term and to provide learning that we can share across the UK in the coming years. We really know the incredible work that charities are doing within communities and with our citizens. And we think that this model, this collaborative model, will make a real contribution to evolving a wellbeing society that we all want to see. So we're delighted to work with the Alliance and the partner organisations that are going to take this journey with us. And I'm really pleased to be launching the Living Well Emotional Health Matters programme today.
Hi, I'm Ghazala Avan, and I'm the Programme Manager at the Mental Health Foundation.
Hello, and I'm Georgina Charlton, also Programme Manager from the Alliance, and we are pleased to be managing the new programme, Living Well, Emotional Support Matters.
So just to give you a little bit of background about what we're doing. So we're currently in the process of meeting with selected organisations across Scotland which focus on long-term health conditions. We selected these organisations on the basis that we have a good mix of organisations that are working across or with different population groups, such as young people, older people, women, men, people with sensory impairments, and people with long-term health conditions. In addition, we wanted to cover rural populations as well as obviously urban populations. In terms of going forward with this work, we're taking an asset-based approach, which recognises the role of the voluntary sector in establishing long-term relationships and trust with the communities that they've worked with for years. For this reason, we believe that they are best placed to develop, promote and protect the mental well-being of the communities they work with. Our role in this project would be to build on the excellent work these organisations are already undertaking by sharing our mental health tools and resources. We also aim to bring organisations together so we can learn from this process and our partnership organisations can learn from each other.
However, being an invested in organisation is not the only way that you can be involved in this programme. Over the next 2.5 years, we're going to be collecting, collating and sharing the learning generated through our partners' projects. So if you are also interested in supporting the mental health and emotional well-being of people living with long-term conditions, then you can join us on our learning journey. If you'd like to keep up with the programme, then there is information held on both the Alliance and Mental Health Foundation's websites, and we'll also be sharing updates through social media. Or if you'd like to get some further information on our aims, ambitions and future activities, then please send us an email and we'd be happy to follow up with you. Thank you for joining us today. The Alliance and Mental Health Foundation are delighted to be working together on Living Well Emotional Supports Matters, and we look forward to continuing to promote and support the emotional and mental well-being of people living with long-term conditions.